As was made very clear recently at the International Conference on Mindfulness, mindfulness is everywhere, and that is a growing trend. It shows up in a lot of different places, and today we will be speaking with a friend who is bringing mindfulness to Brazil in the healthcare sector. So come on, let's learn a little bit more about this. Welcome to Mindfulness Voyage. My name is Ted Meissner, and I'm glad you could be here today. Please be sure to like and subscribe to this podcast if you're getting some value out of it. And, well, today's topic is a fascinating one in that mindfulness can show up in a lot of different aspects to people's lives, but also different marketplaces like healthcare and in different countries, each with their own unique cultures and ways of approaching mindfulness practice. So come on, let's talk to our expert today.
Our guest today is Marcelo Demarzo. Marcelo, good to see you again. Thank you so much for being here. It's good to see you today.
Hi, good to be here.
Now, we had the opportunity to be at the same retreat a little over a month ago, but we were also in some small groups together. And it was just such a delight to get to know you that I wanted to share your work with others. But I'm wondering if we could start by having you tell us just a little bit about what first brought you into mindfulness.
So I'm a family physician. I'm a GP, and I'm very interested in health promotion since my career, my medical career. So I started to search for some tools to promote that inside with my patients, with the people around. And so I studied physical activity as a health promoting tool. I studied Chinese medicine. I studied Ayurveda medicine, and I was a yoga practitioner and a meditation practitioner. And at some point, I found mindfulness. And that point, I was a professor at the university. And so I saw the light. It was my insight to integrate that in my personal life and also in my professional life.
Well, thank you. And it's so interesting how people come to this through different doorways. That for you, you were looking in medicine and helping
Yeah,
others. And for
yeah,
many of us, we come
that's it.
to it from some difficulty in our own life.
Yeah,
It's just interesting that there's so many different ways to find this.
yeah,
Well, tell us about Centro Mente Aberta. What is that and what do you do?
yeah. In my way, as I said, I'm a professor at the Federal University of São Paulo. And so I had the opportunity to open up a center, a mindfulness center inside the university. It was 2011. And in my university, we can launch, we can build up a center, a special center in a special topic. And so we start with research, with outreach activities to disseminate mindfulness among Brazilians, patients as well. And since 2014, we start to train professionals to teach mindfulness. So we have the whole ecosystem regard mindfulness, teaching, researching, and training other professionals.
Great. I'm curious to hear a little bit more about what mindfulness is like in Brazil. Is it common to find meditation centers, or is that still a little bit uncommon?
Getting more and more common, but it's not easy to find a mindfulness center, especially if you go to the universities. But it's becoming more and more popular among the population. But we have a difficulty that is the word itself. So when we use mindfulness in Brazil, we have a translation for that. It's atenção plena, but the term doesn't mean nothing for everyone. So you have to translate in terms of managing stress, getting a meaningful life or more quality of life. So, but if you go to the meditation, the bigger context, it's more popular in Brazil. So people usually know about or it's the right practicing. So you have to most of the time make this connection between mindfulness and meditation and explain better what's the difference.
So it's interesting that this is one of the challenges you're running into is just the languaging of what
Yeah,
mindfulness might mean to people, that it's fairly new in Brazil, but also
yeah,
what are some of the other challenges you're running into with this as well? Because there's probably more than that.
yeah. We have, I believe the big challenging for mindfulness is that we are promoting habit changing, so uh, changing behaviors. So it is always difficult to promote changes in our behavior. So when we promote mindfulness, we have this big challenging as well. And now, a particular challenge we have in Brazil is that sometimes people mix up mindfulness with religion, and there are some barriers in there. And another challenge is that people mix up mindfulness with meditation, and some people say it's not for me because I can't be without thoughts or I can't be focused or something like that. So we have to clean up these misunderstandings of mindfulness. So I believe it's the same around the world.
Yeah, I agree, Marcelo. This is something that is very familiar. The
Yeah,
confusing of what we're doing with a
yeah,
contemplative practice like mindfulness with
yeah,
religious and ideological
yeah,
views, and just the
yeah,
understanding of what it's like.
yeah. On the other hand, we have in Brazil, for example, inside our health system, we have a public health system in Brazil, like NHS in UK. And inside our public health system, we have a special policy for integrative medicine. So meditation is expected to be inside the health system. So we have this door to present mindfulness to the population.
That can make a very big difference. It's one of the questions I wanted to ask you about
Yeah,
health promotion in Brazil, and particularly mental health promotion, if
yeah,
mindfulness is part of that. And it sounds like it is.
yeah. As we are talking, it's not so popular, so much popular, but we have a door in that. We have a policy on health promotion. We have this public health system, and we have health managers that are interested in that. So we have a big door to present mindfulness in that. But in Brazil nowadays, it's much more common to understand the role of meditation, but not specific by mindfulness. So that's our big work to do.
Yeah, yours and I think all of ours within the field of mindfulness, because that's
Yeah,
a pretty common thing we run into.
yeah,
One of the things you mentioned at the retreat was a conversation where each of us stood up and spoke for a bit. And one of the things you mentioned was the British Association of Mindfulness-Based Approaches, BAMBA, that
yeah,
you were also thinking of developing, or perhaps we're working on a Latinx version of that. I'm wondering if you
yeah,
could say just a little bit about that.
yeah, sure. Just to say, we have inside our center, we have a network of mindfulness teachers. We call Mente Aberta Network, Rede Mente Aberta in Portuguese. And we follow the Bamba guidelines for best practices inside our center as a training center reference in Brazil. So we're trying to develop that in terms of Latin America. So, and we have several partners in Chile, in Argentina, in Colombia, Mexico. And so we are gathering these people, and we've been talking for years about that. But now we are establishing what we are calling La Bamba, would be the Latin American kind of Bamba. So with centers around Latin America, but with the same mission, with the same goal, that would be to qualify the field. So to promote best practice and guidelines for mindfulness teachers, especially those who work with protocols, with structured protocols as we work.
It's wonderful to see that happening. And I think in the room of 200 some people, when you said La Bamba, I think it was the only person who laughed at the lightness of that and the appropriateness of it. And to
Yeah,
see that there is this wonderful collaboration, where people in South America use different languages, and this is
yeah,
such an important progress to see mindfulness showing up for people in their native languages,
yeah,
whether it's
yeah.
Portuguese or whatever it
At least
happens
to
to be.
me, yeah, Portuguese is the smallest one. Most people talk in Spanish. As I talking, I speak Spanish as well. It's easier because I lived in Spain for a while, so it facilitates the way to do that.
Yeah. Now, for those who are watching or listening this, of course, I am going to have links to Centro Mente Aberta. That is already in the description, as well as some of the research you're doing in your lab.
Yeah.
I'm just wondering if you have any parting recommendations or thoughts for people who may be watching this, if they want to get hold of you, for example, what would you have to share?
Yeah, we have a special protocol inside our center that we call MBHP, stands for Mindfulness-Based Health Promotion. So we try to work mindfulness informed by the theory of health promotion. And we have several papers on that. So if you are interested in this kind of concept or application, so it would be nice to have a look in our research profile. So we are trying to introduce this special protocol that was developed to Latin America culture. So we translate to Portuguese, to Spanish, and to our culture especially. So it would be a very would be very nice to know more about that if you are interested.
Awesome. Well, our guest today, Marcelo Demarzo, thank you so much for being here. Good to see you again.
Good to see you. Very nice to be here.
It is so fascinating to hear about the different places mindfulness is taking hold. And in healthcare in Brazil, what an amazing thing. I'm so glad to see that happen, Marcelo. Thank you so much for really spearheading that work. Until next time, everyone, remember, every moment you have a choice. Make it the best you can, and I'll see you soon on Mindfulness Voyage.